Health Minister Moses Jn Baptiste hopes to build public confidence in the island's healthcare system upon completion of his term in office. The island's main health facilities have gotten a bad rap for poor service and long waiting times. The recently installed minister also holds the portfolios for wellness and elderly affairs. Monday, August 10th, 2021 officially marked Jn Baptiste's first day on the job. He has been busy acquainting himself with duties of the various departments.
Well, I want to be able to say that my term as the Minister for Health, Wellness and Elderly Affairs led to a health system with better access, better care for our people in St. Lucia, and also a system where our people can afford healthcare services, especially basic healthcare services. I want to be able to say that I was able to galvanize our team. I was able to motivate our team, not only in the Ministry of Health, Wellness and Elderly Affairs, but all across St. Lucia, where you have individuals and organizations who are connected to the healthcare system. I was able to motivate them and galvanize them into action so that the clients, our people of St. Lucia, can get better health care. And I'm sure this will happen. I want to be able to say that we were able to complete our facilities and to make them available to our people. Of course, St. Jude Hospital being the #1 healthcare facility. So all in all, I want to be able to say that our people, at the end of our 4 years and 11 months to come, I'm sure I'll be able to say that our people have access to better healthcare, and they're able to access healthcare which is much more affordable, and people can have confidence, a lot more confidence in our healthcare system.
Jn Baptiste also got the opportunity to sit down with the staff at the Victoria Hospital.
I have had several discussions with Dr. Sharon Belma George since Friday, especially on the COVID-19 situation, and she has been very helpful with information and with guidance, and because with her guidance and so on, I then proceed to speak with the Prime Minister and to advise the rest of the cabinet, members of cabinet. And so we have had several discussions. I also held discussions with the team at the Victoria Respiratory Hospital, and again, pretty insightful in terms of the operations and the challenges, and we discussed ways in which we can make things much better for them at the Victoria Respiratory Hospital. I held discussions with Dr. Francois at St. Jude, and again we discussed the challenges and so on. Other staff members, we've been exchanging pleasantries, and I'm trying to learn my way around, while at the same time dealing head on with the challenges of the COVID-19 pandemic. We have had an increase in the number of cases, and we have been dealing with that. We are just having a discussion with Dr. Sharon Belma George and her team to see what challenges lay ahead, and how, as a government, we can unclog some of the choke pipes to ensure that we achieve our objectives.
The minister says he is up for the challenge.
Discussions, the usual discussions with the Permanent Secretary, very pleasant, and he gave me an insight into the vastness of the Ministry of Health and Wellness and Elderly Affairs, and we discussed the structure of the ministry and the key actors in the ministry. So very exciting, and I look forward to the challenge. A very challenging pursuit, but clearly very important to our government, as healthcare and this emerging health crisis, is the #1 priority of our government.
The reconstruction of the St. Jude Hospital remains a top priority for the health minister. Jn Baptiste is also focused on providing access to basic health services for citizens. Gina Filippi, HCS News Force.